All right, you are lucky to be a part of this next panel. This is an excellent example of how Think and Do works. You're going to be able to see how some of the insights that have been articulated earlier are being actually acted upon by very creative members of communities in Texas. It also kind of illustrates a little bit about what we do at IC Squared. And one of the key starting points is Dr. Jim Jarrett was working with our Texas State Library and Archives Commission on a digital literacy study. This gave us a chance to speak with over 300 librarians across the state. And we began to understand what digital literacy meant. Not just access, but how to use the devices, how to use apps, how to engage with websites. And then this also introduced us to very innovative librarians, which allowed us to meet other individuals across the nation and other models. So you're going to see how this data kind of synthesized together. So one of the things that kind of came out, and this is just saying what you already heard, healthcare is not simple. It's a continuum of activity of pre-meetings with physicians, meetings with your primary care, specialists, follow-up, etc. This really requires the patient to take ownership of their participation. Many actors have to be coordinated. The services have to be articulated together. Time and resources and interventions have to be engaged. Navigation is a big problem. Where am I going? How do I get into the system? Where do I go next? And follow-up is absolutely essential, but not intuitive. What we're learning is that their barriers are really complex as well. Between the patients and this early engagement with the healthcare continuum and the community is really the key point. And this is where we're understanding where getting into primary care, whether it's mental health or medical health, offers the best way to buoy against long-term health issues. Access is we're going to talk about it as a complex of many factors that really acts as a super social determinant of health. This is digital access, literacy, and the navigation required to use those systems, engagement with available services. I cannot tell you how many communities we've interacted with, and they'll tell you all the services that are involved. But you talk to the people who need them, and they say, no services are available. This is almost universal. Yes, you can have betterhelp.com, gethelp.org, but you know what? People don't know how to use those systems. Finally, we've heard it time and time again, distance, transportation, and access is a big issue. So how are we engaging this? Well, nope, there's supposed to be arrows. There we go. We think that there is something really important about this idea of taking some of these elements you're going to hear and putting them all together into a hub, into a local hub, where you now create a front door into the healthcare continuum. It's a place-based front door. It expands where healthcare is available. It leverages technology to not only engage the healthcare system, but to deliver healthcare. And it diversifies who can inform and engage in the healthcare process. We've had a chance to work with this idea by finding that the key aspect, and you've heard this over and over again, is trust. Anchor institutions and selecting the right ones in communities is very key because they bring to the community trust. We found that these community anchors have the ability to actually facilitate how resources are allocated and navigated, how they deliver care to the really fitted needs of the community. They're not just like, we do everything, we do some things that the community needs. And finally, they don't recreate anything. They create leverage and navigation to what's already happening in the community. And we really have found some exciting examples you're going to hear. This happens in public libraries. You'll hear about actually virtual healthcare being delivered, telehealth. We can talk about the fact over in Del Valle, they transformed the old library into a two-part environment. One part is involved in reading for children. The other part is a client-determined shopping experience for healthy food. So moms or dads can come in and shop while their kids read. This gives a chance, you're going to hear an amazing set of stories about how affordable housing groups are building business models around wraparound services for well-being. This is not just with the area of healthcare, which you're going to hear, but just this month, Foundation Communities actually filled out more tax returns than any other place in Texas, done by UT students in accounting to help families in need. So it's a wide range of services. And finally, faith-based institutions. How do we unite the passion and the care of these organizations and connect them to those in need? You're going to hear about how there's a sense and respond process engaged so that the spirit, the body, and the mind can all be affected. So what is a well-being hub? We think it has three particular dimensions. First, there's physicality. It's not enough to just say, do everything virtually. Folks, people don't know how to do things virtually. We may in this room, but we are at this far end of the area. So we need a place for access, sometimes digital access. We need navigation for support. We need the ability to provide that literacy training and a site possibly to deliver care. An example is most of our mental health resources are mediated across Texas in spaces the size of Massachusetts. So you're going to have to drive from Boston all the way across the state if you're going to get that care. But in a library, we can put it in the community, in the county, Newton, Jasper County, for example. There's a social aspect to this, navigation, taking advantage of what people need and linking to what is offered in the community. And finally, digital. As you'll hear, real-time communication is the key. In other words, I don't have to take a survey by going to a particular place. I can communicate, I need help. I'm feeling this way when I'm feeling this way. And that data tells us much about the community and allows us to create these fitted services. So we have benefited from these incredible folks here who we've been able to interview, learn from, and I hope you're going to just leave here going, that's how Think and Do works. We find data, smart people, and we work together to create something possibly interesting and new. So I'm going to turn this over to Craig and